Good afternoon, everyone, and thank you very much for joining us on this unusually busy Friday afternoon here after a very long session. We really appreciate you taking the time to join us for this side event that will focus on youth-driven insights on opioid harm reduction. My name is Beatrix Wash. This event is organized by YouthRise. We are a global network of young people who use drugs and young people otherwise affected by punitive drug policies. We mobilize youth to engage in full-spectrum harm reduction and drug policy reform. The acronym in our name stands for Resources, Information, Support, and Education. And as a network, we produce and support research and reporting on challenges faced by young people who use drugs or intersecting identities, and we bring our realities to decision-making bodies nationally, regionally, and internationally here at CND and in other fora. This year, YouthRise has worked on a research paper focusing on young people who use opioids and the unique challenges that young people face. So our side event today is centered around that. We have an incredible panel who will showcase parts of this report that you should have seen all around the building throughout the week. And I think we have some copies of it still in the room as well. But you will also learn from our own personal experiences and other work that's been developed by YouthRise around youth engagement and making sure that harm reduction meets the needs of young people. So without further ado, I would like to introduce our first speaker, Rebecca Rocha, who is the High-Level Advocacy and Communications Program Lead at YouthRise. She is also a PhD candidate at the Central European University here in Vienna. And Rebecca will set the stage for us today to talk a little bit more about the research project that was developed.
Thank you, Beatrix. Good afternoon, everyone. Should I say good morning, maybe to some? So I'm speaking today on behalf of my colleague, Rebecca Calzada, who was the research and knowledge coordinator at YouthRise and also the person who led the study that we are presenting today, that you can see also being shown in the screen. I'll speak very briefly about the methodology that was used in this study, because at YouthRise, we see young people as experts, partners, and collaborators for the gathering and cultivation of the evidence that support policymaking. So with this in mind, our research methodology recognizes and centers around the lived and living experiences of young people. And indeed, we believe that on the ground, firsthand experiences are crucial to respond to the dynamic drug challenges and realities that are faced by young people all around the world. For the development of this study, we engaged with young people who use opioids and harm reduction practitioners and acknowledged them not only as participants, but also as collaborators. So that means that they were engaged with their expertise and we welcomed their contributions in all of the stages of the research process. So the question planning, also the coming up with the literature review, gathering their insights, and also writing the actual report. So the study involved a cohort of 8 representatives of young people who use opioids and young harm reduction practitioners from Canada, Indonesia, Kenya, Mexico, Portugal, Uganda, the United States, and Zimbabwe. So throughout the research period, which was from the 20th of October 2023 until the 15th of October, also from 2023, they gathered data that was related on opioid consumption among young people who use drugs and harm reduction practices within their local communities and countries. And in the end, they agreed also to be cited as co-authors in the study. So they utilized a qualitative methodology and data for this research was collected through focus groups and the meetings happened remotely and weekly. And the collaborators responded to research questions that focused on the needs and challenges that young people who use opioids face, the challenges that harm reduction practitioners face while implementing harm reduction strategies in their own communities, and recommendations that they had on how to ensure that harm reduction services are accessible and also take into consideration the well-being of young people who use opioids. The discussions centered around their own personal experiences, and they were engaged in a dialogue regarding the most effective strategies to meet the specific needs that they encounter among their communities of young people who use opioids, and that can also facilitate positive transformation within the community. As I said before, the meetings were conducted remotely, and a written record of the discussions was also transcribed. The meeting, they lasted for about 1 hour each, and some key themes were identified in the research, and we will be discussing the results later on by the other speakers in this panel. But to speak a little bit more about why using this methodology for this type of studies, it's basically centering around the objective of recognizing social injustices and giving a platform for those that are impacted directly by drug prohibition, stigma, and discrimination, and provide them a space to be the leaders and leading the discussion around drug regulation, harm reduction services, and drug education. We do believe that young people who use drugs should be the principal stakeholder when discussing the efficacy of current drug policies and in the design, implementation, and evaluation of healthcare services. So this methodology aims to challenge these stigmatizing attitudes and discriminatory practices by acknowledging young people who use opioids and their contributions as valuable insights for addressing opioid use among young people who use drugs. But most importantly, this methodology is based on emancipatory research approach, which is an attempt of decolonizing also knowledge production, because knowledge production based in Western ways of knowing can reproduce the division between the researcher and the quote-unquote researched. And then it also perpetuates power structures that only contribute to inequality and stigma. So engaging emancipatory research methods in our work at YouthRise aims to decolonize harm reduction by decentralizing knowledge production and encouraging instead knowledge cultivation. To produce knowledge is to lengthen, prolong, or extend, whereas to cultivate knowledge is to till, to turn matter around, and also fold it back on itself as to encourage growth. So it is to embrace and value other ways of knowing, and most importantly, it is contributing to the creation of a community that actively works to create spaces for transformative practices that ultimately leads to the emancipation of populations that were historically oppressed by colonial legacies. So I invite you to check this and other research that was conducted by YouthRise. You will also be seeing an image of our report from last year, which was also presented here during the Commission on Narcotic Drugs. And I invite you to check that and other resources on our website and continue engaging in this conversation. Thank you.
Thank you, Rebecca. And I think that was a very powerful point also to speak to how methodologies of conducting research and developing programs can also help us move towards reducing stigma, reducing exclusion, meaningfully engaging young people. I now have the pleasure to introduce Alfonso Chavez, who was one of the participants working on the study that was just mentioned. Alfonso is the coordinator of the harm reduction program of Prevencasa. He has carried out community intervention on drug, health, and human rights issues since 2009. And today he will speak on his experience as an author and also mention highlights from their country context in Mexico. Alfonso, you have the floor.
Yeah, thank you, Beatriz. Okay. I'm Alfonso Chavez. Buenas tardes a todos, todas. I'm from Mexico and I'm based in Tijuana currently. I'm the coordinator of the harm reduction program at Prevencasa, where I have worked for almost 10 years. Provencasa is a community center that aims to reduce the transmissions of HIV and sexual transmissions infections and offers free healthcare and harm reduction services to improve the quality of life of a population facing challenging living conditions, such as young people who use drugs, young migrants, young people deported from the US, young sex workers, and young people experiencing homelessness. To provide some context, Tijuana is situated at the border between Mexico and USA and stands out as an area with a significant fentanyl presence and silencing now. And it is a heavily militarized zone with a very low access to naloxone and a shortage of methadone, which exposes young people who use opioids and other drugs to greater risks and harms. Between 2021 and 2022, my college at Provencasa and I reversed over 900 overdoses, many of them young people, especially after the arrival of the fentanyl on the local drug market. In 99% of these cases, we prevented fatalities. So rest assured, I am well aware of the impact of naloxone and the effectiveness of harm reduction services and the importance of cultivating empathy for young people who use opioids. I stand before you to address the critical issue, the protection of rights and well-being of young people who use opioids. The UNDOC 2023 World Drug Report sheds light on the widespread prevalence of opioid use among individuals aged 50 to 65 in various regions, necessitating our urgent attention and coordinated efforts. During December, 7 other harm reduction practitioners and young people who use opioids based in Canada, that beautiful people, Nigeria, Uganda, Indonesia, Zimbabwe, Kenya, Portugal, and the United States and I gathered in a group discussions to discuss the present challenges of young people who use opioids and harm reduction practitioners. Here I present some of the challenges and recommendations we urge policymakers, state representatives, and other relevant stakeholders to act immediately to protect the rights and life of young people who use opioids. First, the absence of a safe drug supply poses a severe threat to the well-being of young people who use opioids, leading to increased harms and overdoses. Strategies and policies must ensure drug testing facilities that accompany with safe consumption rooms. Also, prohibition and punitive drug policies contribute to stigma and discrimination, which represent a major obstacle for young people using opioids to seek healthcare and harm reduction services if they count on this service. Discriminatory practices commonly come from the state, institutions, and healthcare providers. Moreover, the lack of quality and compassionate healthcare services coupled with the stigma and surveillance practices, impedes young people access to necessary medical and social support. Any type of effort should be emphatic in creating tailored healthcare services, acknowledging the unique needs of this population and dismantling barriers to accessing healthcare and social services. Political inaction over this pressing issue represents a significant obstacle for us, harm reduction practitioners, when we want to effectively respond to the needs of young people who use opioids. If we want to protect the well-being of young people who use opioids, all relevant stakeholders and policymakers should prioritize access to naloxone, access to syringes, needles, funding for civil society organizations, safe supply, and supportive responses over punitive strategies and policies. As harm reduction practitioners, we are constantly dealing with trauma and mental health challenges as we have witnessed state violence and the deaths of young people who use opioids, which unfortunately on occasions are the deaths of friends and family. Also, the lack of support from governments and funding is a great constraint for our work. In addition to what I mentioned before, here I present you a few recommendations we developed from the discussion group. 1, supportive services, not surveillance services. It is essential to create non-judgmental environments that promote access to healthcare, social, and harm reduction services. 2, drug education. We urge policymakers and stakeholders to promote comprehensive drug education rather than myths and misconceptions surrounding drugs and young people who use them. This education should extend to police, public officials, healthcare, and social providers, decision makers, parents, tutors, educators, and society at large, and must include how to respond and overdose. 3, developing data. Reliable and accurate data is the basis for the better policies and strategies that actually protect the well-being of young people who use opioids and other drugs in our communities. 4, youth-tailored healthcare and harm reduction services. The youth must be consulted in the design and delivery of healthcare and harm reduction services. This ensures that the interventions are relevant, empathetic, and resonate with their unique needs. 5, policy changes and stakeholders' active engagement. We urgently need commitment and engagement to stop prohibition and regulate all drugs to ensure safe supply and support for healthcare, social services, and harm reduction strategies. 6, resources and sustainable funding for harm reduction organizations. Essential resources such as naloxone, needles, syringes, safe consumption rooms, and adequate funding for harm reduction organizations are critical to effectively address the needs of young people who use opioids. 7, covering the basic needs of young people who use opioids. The well-being of young people who use opioids and other drugs starts by improving and covering their basic needs, such as access to housing, education, healthcare, and mental care. I urge all stakeholders and policymakers to prioritize the protection of young people who use opioids by adopting a human rights and evidence-based approach. Our collective commitment to comprehensive drug regulation, destigmatization, youth-tailored healthcare, and enhanced support for harm reduction practitioners is essential to creating an emphatic, safer, and more compassionate society for all. To close my intervention, I would like to cite what other colleagues in harm reduction have also said. From Vienna, you don't see the bodies of young people who have overdosed. From Vienna, you don't see the trauma and obstacles we constantly encounter. From Vienna, you don't face the violence that threats our vital work. If you are hesitant about what I have presented before, please come and visit us. Thanks so much for your attention.
Thank you very much, Alfonso, for that powerful message, and then for highlighting the recommendations as well. As it was mentioned, the study covered several countries where young people have been affected adversely by lack of access to services, and Canada was one of the countries, and we also really wanted to highlight the Canadian experience on this panel today because, as you might know, Canada has been one of the countries most severely hit by the overdose crisis in recent years. So also to talk a little bit more about this and how it has affected young people, we are very fortunate to have Alex Batsos, who is the former international rep for Canadian Students for Sensible Drug Policy and a current member of Youth Rise's International Working Group. They are also a PhD student at Rensselaer Polytechnic Institute, and they study the relations between drugs, science, technology, and the relations between international and Canadian statecraft. Alex, you have the floor.
Awesome. Thank you. The overdose crisis in Canada has been going on for so long that it has become the everyday state of affairs for young people and adults alike. Politicians in Canada have lost what little political courage they had at the start of the overdose crisis in 2016. That courage, or the political willingness to try new things, has been replaced by a right-wing backlash, propped up by a moral panic that revolves around using the lives and deaths of white young people as a political cudgel against racialized and Indigenous drug users. At the beginning of the COVID-19 pandemic, Canada's already incredibly toxic drug supply became even more volatile. In response, several provinces, including British Columbia, began providing pharmaceutical alternatives to the toxic drug supply for drug users. These drugs include hydromorphone and slow-release morphine, as well as dextroamphetamine and methylphenidate. Research on this intervention is still forthcoming, but early evidence suggests that these programs save lives and lessen the likelihood that people will overdose. Despite WHO recommendations, young people still do not have easy access to these services, as well as naloxone, OAT, drug checking, treatment, or supervised consumption sites. As more and more young people die from drug-related overdoses, young people in Canada are still being left behind. Over the past 2 years, I have watched as young people's deaths are paraded around by Canadian media in an attempt to end the Safer Supply program. I want to be clear, no young person who uses drugs wants their deaths dramatically displayed for all to see in a major Canadian newspaper. No one wants to be the poster child for incarceration and death. Yet, the only time we seem to want to listen to young people is when they can no longer speak for themselves. In February 2024, Canadian news outlets began running stories about Camilla Sword, a 14-year-old youth who tragically passed away from a drug-related overdose. The initial toxicology report found hydromorphone in Camilla's system, as well as cocaine and MDMA. We do not know whether the hydromorphone came from this program or instead from the much larger population of people prescribed hydromorphone in BC for pain every day. In the full report that was released just this January, the coroner attributed Camilla's death to cardiac arrest resulting from combining cocaine and MDMA, and that it was unlikely that hydromorphone played a role. Yet, the media did not wait for this report to come out. Instead, Camilla's life, as well as her personal struggles coming out of lockdown, were run in newspapers across the country. That Camilla faced mental health struggles after lockdown were but footnotes to a broader story about the dangers of hydromorphone. Camilla's story speaks to real problems faced by young people. Many of us, especially those who are disabled, racialized, colonized, and/or poor, were heavily impacted by necessary and life-saving COVID-19 lockdowns. Camilla struggled with mental health challenges during the lockdown, and she began to use drugs to cope. Was her story used to highlight the importance in massive investments in counseling for young people? For better drug education? No, it wasn't. I wish our governments had listened to Camilla when she was still there. She could have told us what she really needed, and now, unfortunately, it's too late. As states seem uninterested in lowering their carbon emissions, young people are inheriting an increasingly uninhabitable world. Unaffordability is skyrocketing, healthcare infrastructure is failing, and livability is decreasing. States have abdicated their responsibilities to young people. They're not willing to leave the world a better place for them to live. We want to avoid stories like Camilla. We must invest in the dream that a better world is possible. When young people have fought for this better world in Canada, they have been punished. In October 2023, Canadian police arrested 2 members of an organization named the Drug User Liberation Front, or DOLF. Using the darknet, DOLF purchased drugs that they then tested and provided to drug users in Vancouver. In a recently published paper, those who were accessing their Compassion Club were less likely to die of overdoses than their non-safe supply colleagues. DOLF's vision is the sort of radical thinking that youth, in collaboration with others, are bringing to end the overdose crisis. It may not be pretty, and it may be devoid of empty platitudes like a drug-free world, but unlike our governments, DOLF is imagining a future where no one has to die of a fentanyl overdose again. Young people do not have time to wait for the Canadian government to get its act together and end this crisis. Instead, to protect our friends, family, and loved ones, against the odds, we will seek to imagine that another world is possible. Stop using our deaths as weapons against our friends. We do not have time for your propaganda. We have a world to win. Thank you.
Thank you, Alex, and thank you in particular for speaking to this contradiction that we've often mentioned in our engagements here, where young people and the issues faced by young people are, and young people's protection is very much highlighted when we are talking about drug use and drug use related policymaking, but it is quite rare that young people are meaningfully involved in decision making. So often these decisions happen without understanding the needs and without providing spaces for young people to provide their inputs. to influence these decisions. So to explain a little bit more about what we understand as meaningful youth engagement in policymaking, including here at the CND, we have with us Ruby Lawler, who is the Executive Director of Youth Rise and has been working on youth-centered drug policy, reform, advocacy, and harm reduction since 2017. Ruby, please.
Thank you so much, Trixie, for the introduction. And I guess I'm going to try to put a bit of a solution way or a method in which we achieve what we're trying to achieve here and end the severe harms that drug policies are causing to young people, the overdose deaths, the health and human rights challenges as well. And this is through meaningful youth engagement, particularly young people who use drugs. So yeah, from what we've heard, obviously, punitive drug policies are not serving their intended purpose. They're causing significant harms to our population. Drug use is ever growing amongst young people, as you can see in the World Drug Report of the UNODC itself. And recent findings also show that there is a 50% higher average risk of HIV and HCV acquisition for young people who inject drugs. So in a recent effort, and I guess as an example of what meaningful engagement of young people who use drugs can look like, Youth Rise coordinated a multi-stakeholder consultation to establish a dialogue between the academic community and the community of young people who use drugs, alongside and supported with UNODC, UNICEF, the World Health Organization, input in November 2023. And so this youth consultation brought together experts from academia, civil society, and UN bodies to provide the most recent, where available, research on drug use amongst young people, the impact of policies, provided insights about realities, challenges, and barriers faced by young people who use drugs in terms of accessing basic healthcare, harm reduction, treatment services, and then how to overcome these, and also a session on evidence-based drug education, which has been a hot topic here this year. So the main findings in regards to how to overcome barriers to access and reducing the harms of current drug policies on young people was through meaningful engagement of us in the design, development, implementation, monitoring, and evaluation of drug and harm reduction policies and programs, and in harm reduction service provision itself. It was also explained that the main barrier to accessing harm reduction services is punitive drug policies themselves, and that currently existing drug policies that criminalize us are responsible for some of the most severe harms associated with drug use, not the drugs themselves. To be able to effectively craft policies that leave no one behind and initiatives that are harnessing the transformative power of youth, two quotes from the recent UN documents and UNODC documents on leading up to the midterm review, it is critical that young people and our lived experience are meaningfully included in drug policy activities globally. So to create and support the meaningful engagement of young people in policies and programs, we need to be provided with education on relevant policies, documents, and guidance related to drugs, technical expertise. Young people who use drugs should be provided with technical trainings that will empower our active involvement and build our capacity. It must ensure this engagement happens throughout the entire policy-making process, from the implementation, but also monitoring of the impact amongst our population in order to craft better drug policies and reevaluate and reassess them, to make sure that they're equitable and reflect the true needs and interests of young people. And then the results of our engagement must also be made explicitly clear to us. Then that helps us to go and bring this engagement and this example to other spaces and build upon that. We must also acknowledge and encourage peer-to-peer work amongst young people and young people who use drugs as the most effective way to engage with the difficult-to-reach populations. You can't expect an adult peer to have the same sort of impact and engagement with a young peer. It must be within the population itself. And we also recognize the developmental stages and specific needs of different age groups of young people who use drugs, including the socioeconomic context and the role of education, housing, and employment in young people's lives and development. Further, we must be provided with opportunities for funded employment within policy-making bodies, to not have an extractivist relationship with us, ensuring young people who use drugs are part of designing frameworks for our own meaningful engagement, and crucially, young people who use drugs should not be excluded due to criminal records. UN bodies and regional and national decision-making bodies must ensure transparent and clear criteria for selection processes for our engagement opportunities, such as the UNODC Youth Forum the UNODC must stop limiting youth engagement in the available opportunities it promotes to only those young people who do not currently use drugs. It is not meaningful youth engagement if you only engage with youth with one perspective and one lived experience. We matter as well. Governments should include young people who use drugs in their country delegations, giving us opportunities to also attend the Commission on Narcotic Drugs, which we're here at today, the proceedings, and provide input on the realities in the global policy discussions. It must be made explicitly clear what the safeguarding and confidentiality frameworks are for any engagement of young people who use drugs in these spaces. And finally, youth-led organizations should be funded directly as autonomous entities with core funding so that we have the ability and opportunity to act in the best interest of our communities and push for meaningful engagement at all levels. Thank you.
Thank you. Thank you very much, Ruby. That was fantastic. And thank you to all of the speakers for these presentations. All of you have addressed different barriers to young people that we face in accessing services and issues that affect us. And you've also touched on issues that we face when raising these when talking about our own needs. I would love for us to spend a little bit more time on this. So I would just like to ask all of you, like, what do you think is the biggest barrier or the biggest challenge to be advocating for yourselves as a young person, to be included in research, to be included in service delivery, to be included in policy making?
I think I kind of just touched on it as well, but I guess the fear of being criminalized, you know, it's if we're going to engage in research or policy decision-making bodies, if we're not told what the safeguarding measures are, then we're not going to engage with it because we'll think it's a trick. Why would a decision maker be inviting us to influence policy when they are the same decision makers that uphold the laws that criminalize us? It's not a safe space, but it's not something that's impossible to do. You can make it a safer space for us. You can, make it really explicitly clear what the safeguarding is, and to engage us in discussions early on in the engagement as to how we want to see it happen and what we need to happen to make sure that we're kept safe. And yeah, I think through showing how important we are and through more engagement discussions with us in informal manners, we'll build trust and develop trust. If you get a random invite from someone to attend some meeting, some government body, you're not going to think that that's something that's going to be safe for you. So it's a difficult process, but it's a process that you engage us with to figure out for you and for our context. That's, yeah, my idea of it.
If I can just jump in and compliment a bit on this, beyond the fear of being criminalized, even in spaces where you're not criminalized, there's also the fear of stigma and the repercussions that it might bring to your life whenever you identify yourself as a young person who used drugs. And what is the impact that this is going to have in your own development, in your career building and, life prospects, because we do live in a society that still stigmatizes people who use drugs and still believes that one identity of one person is only solely defined by whether you engage or not with substances, when we can be so much more while also using substances. And if I also may add, access to resources, I think it's something that it's really hindering the capacity of young people to engaging in these spaces, because even when they are provided, as Ruby said, if you're invited to attend a meeting and provide your inputs, we must ensure also that we are not being utilized in a way and discarded afterwards. So value the input of young people, but also offer a way of young people to be emancipated and also leading the discussions, not only whenever it's convenient to have them engaging on them. So meaningful engagement of young people is being able to acknowledge, welcome, and implement the recommendations of young people, even when they are not in accordance to the opinions that are upheld by, the more experienced, I suppose, part of the population.
I mean, so I'll just note that I think one of the kind of challenges in this space is I also recognize who's not able to make it here. It's much more challenging for Indigenous youth in Canada to be able to get seats at the table when it comes to this stuff. Normally, you have to spend, even just to get to the international stage, you have to spend a whole bunch of time in this kind of big like sieve of people who, don't necessarily have the capacities to be able to engage. And so I think in terms of barriers to access that, yeah, there needs to be a lot of support, but also recruitment and going into communities that might not necessarily know to look at the Government of Canada's website that they're, trying to request youth. I think like an active effort needs to be made, and that can be done in partnership with drug user unions or other harm reduction spaces. But I think, yeah, there's also a challenge here in that, like meaningful youth engagement does not just include youth who are well-spoken, who have bachelor's and master's degrees. It includes folks that, would not get access to the space otherwise.
One comment very quickly. I think that how we can start to think and include to the young people who use opioids in the in the policies. It's very complicated because I think every context is different. But in my community, we can't start thinking about it because we have a country, a nation military with military, yeah, new guard, new security guard, and all the police in the streets, and it's very complicated. So I think we have to start to think in safe spaces. In our community, we start to operate a safe consumption room. It's the second in Latin America, but it's not enough. We need to change all the context for the well-being of the young people. So yeah, I'm thinking that.
Thank you all. Thank you all very much for those great inputs. It's really interesting to raise the concerns about security when engaging in these issues and the need for also safer spaces for young people to engage in advocating and in engaging in providing services for other young people as well. So I also wanted to follow up on that and ask you a little bit further about what do you think we can all collectively do to make advocacy, health services, harm reduction spaces safer for young people?
Yeah, I think that one point was already touched upon. Yeah, ensuring that people are not going to be criminalized whenever they are going to look for these services or they're trying to access these services, but also trying to acknowledge young people in all their diversity and acknowledging that different young people will have different needs and different spaces and formations of the space that will need to be provided in order to ensure that all of the different experiences that we have are safe to everyone in our community. So acknowledging the intersectionality and how those might also contribute to further stigmatization, further criminalization, and peer-led services that are also involving the community and led by the community is also very important to ensuring that they are safe for all people, all young people.
I think two kind of thoughts. One is to make sure that there are easy ways for young people to create those spaces for themselves. You know, a lot of grant applications are very can be very challenging to follow, even for, you know, people who, you know, have had the kind of privilege to be able to go through the, you know, graduate like or like undergraduate like education system in Canada. I think like we have like really lost a lot of like youth-led spaces that, you know, used to exist, especially in the 90s. And I think that, yeah, the first step to making safe youth spaces is to have youth making those spaces.
If you don't, if you wouldn't like to comment on that, thank you very much for those answers. I think, yeah, those are very important. Also to involve young people in creating these spaces, such as convening events like this today. We have about 10 minutes left, so at this point, I would like to open it up for questions from our audience. Please raise your hand and unmute if you have any questions to our panel. Can you please use the microphone so the people online can also hear us? And could you please introduce yourself? And
Okay, my name is Azra Panjwani. I'm with Canadian Students for Sensible Drug Policy. What is your ideal vision of a youth-led and youth-oriented, like, safe space for people who use drugs?
Okay, vision for youth-led safe spaces. Well, it would be funded. I think that's pretty core to it. It would have it would enable for diversity and intersectionality. So it wouldn't be a space that is only young people who use drugs from maybe one race or one socioeconomic background, that they would be peers from across the different diversities to also influence how the space gets created and then to bring people in. Yeah, I think funding is a massive one, to also pay for young people's time as peers. I think this was mentioned really well by colleagues from Sanput the other day in a side event, that it's not just some subsidiary amount that you get per day as a peer, that you're paid as someone who's, you know, work is valued and time is valued, and that also counts for young people. And I think because people see us as like, in a more professional sense, early career, or like in a less professional sense, we're just doing this because we have passion at this age and we want the experience, that's not a valid excuse not to pay us for our time. And so that counts as well for any community spaces that we make. Those involved in creating them at different levels are also paid for their time as well. And that allows for the sustained movement and community.
So a couple of years ago, I was working with this youth drug policy advocate named Rainbow. For those who don't know, in Vancouver, a couple of years ago, they shut down the only like youth treatment center that existed for young people, known as Directions. And that place, you know, handed out harm reduction supplies as well. It, you know, gave youth food and meals that they could have, and when they needed to seek that care, they had a bed that they could go to. And so I think that the ideal space is going to vary depending on which community you're talking about. But yeah, I'd like to emphasize Rainbow's dream vision, which was to have this community center that her friends could go to and be safe if they needed to, and be able to get support and to have, you know, conversations. And if they needed to if they wanted to go to treatment or into recovery or whatever, they were able to access that as well.
And I think that, in my opinion, whenever we talk about substance use and whenever we talk about services, it's very much still focused on the conversation surrounding on risks and impeding very negative things. And we don't really acknowledge why young people also engage with substances. There is the experimentation, but there's also the pleasure that is involved on it. And there's the ability of creating communities that surrounds those, social interactions whenever you engage with drugs. So I think ideally, young people, meaningful engagement in politics would also acknowledge this need and desire of young people to be active leaders and to create the communities themselves. And doing this all while still doing it in a pleasurable way and taking joy out of those spaces, not only trying to reproduce a narrative that it's highly negative and focuses only on the negative aspects of it. For example, I've seen I lived for a little bit in Portugal and I worked with harm reduction in Portugal, and I've seen the potential of young people, grassroots level movements of coming up with innovation for harm reduction whenever they are provided with the resources and whenever they are provided with the space and support from the state for not criminalizing drug use anymore, but rather acknowledging drug use in the agenda of the health minister and providing financial sources to harm reduction organizations, which allowed harm reduction organizations to also bring young people to work and collaborate with them. And I think that in terms of harm reduction, there's a lot that could be learned, especially in harm reduction for recreational drug use. And the moment that you start not stigmatizing those different objectives and engaging with substance, then you are truly able to come up with true innovation and policies that will effectively work.
Just if you want to do further reading and learning about what makes a space young people use drugs friendly, young people use drugs led, I'd recommend you check out our report from, I think it's 2021 when we produced it, which documents best practice examples of what this looks like in countries all around the world. And then lists out exactly what is needed in harm reduction spaces and community-led spaces to make sure that young people who use drugs are part of leading it and then also engaging with them as well. So if you look at our resources website, it's called Young People Who Inject Drugs Harm Reduction Services. I'd really recommend reading that. It's very comprehensive.
Thank you all for those great answers. Do we have any other questions from the audience? Yes.
Hey everyone, Amin Mutuais. Thinking about young people's use of opioids, I can't help but being a little more frustrated that naloxone, that life-saving emergency drug, is out of reach of the people who need it most in some context. So my question is maybe for Alex, who's coming from Canada, which is a country that naloxone is deployed at a community level. Along with advocacy, what are the other strategies that activists in some country can use in order to bring naloxone at the community level? Thank you.
Okay, that's pretty hard because naloxone is just the fight for naloxone in Canada is just a little bit before my time. I do remember it happening. I think like one of the things that's really critical is that there's no reason that naloxone is available by prescription only. You can't get high off of it. It saves people's lives, and there's no evidence to suggest that people can misuse it in any way. I say that personally not thinking that our current system works, but even if you think within that framework, like it doesn't make any sense. It's completely like incoherent to have it scheduled. I mean, I think that that's going to depend on context to context. But the ways that, we make gains on anything is by connecting with people who are willing to kind of take up our cause and, care about, people who use drugs and, especially young people who use drugs not dying. And to try to find allies that you can work with to kind of move that dial forward. I'm sorry, I wish I had a more explicit answer, but it's, yeah, just do it until you win. Sorry.
Can I say something? Just for say something, an experience for my country in Mexico, for example, over the 900 overdoses that we attend, the naloxone is donated by organizations, internationals, but in our country, we don't have an naloxone. We don't have a facility for the community, and even the funding, this administration cut all funding for organizations with community-based. So it's very important because we can compare the situations in both countries. In the border, for example, we have a tourism, sexual tourism, and drug tourism in our community. So it's very complicated because many people, especially from USA, come to the city to use drugs. Many people are died for that reason. So it's very important to facilitate the naloxone for the persons.
Thank you all. Thank you for those answers. We are just about on time, but if there are any other questions from the audience, I think the panel would be happy to answer. If there's no more questions, I would like to place a final question to all of you, because I think it's been really powerful to hear a very strong call for harm reduction, and for harm reduction not just as a health intervention, but encompassing every related social issue, tackling safety, housing, food. So thank you all for those very powerful messages today. And we are here, obviously, at the Commission on Narcotic Drugs, and it's been a very intense week, including still debates on what harm reduction is and what contexts harm reduction is acceptable in. So I just wanted to wrap up this session in asking you about your experience attending CND this year, and what is one thing you are taking home, or one thing you would like all of the delegates to take home from this week. It's a broad question. Pick what you like.
What I think of the experience of attending the CND, I think you can see on my face. It's exhausting, but it's also a space that provides you the ability to contact people that you wouldn't have the chance to get so close otherwise, especially as a young person. So I live inspired by all of the amazing activists that I have seen, also the young people's movement and all of the people that are doing amazing stuff with very little resources back home. And it's also an amazing space to share experiences and things that we are doing in our own communities, because I mentioned this when we were talking about methodology, but it's acknowledging different ways of knowing that might not necessarily be the traditional ones in terms of transcription and having it documented, but there is this oral knowledge exchange that happens during the CND, and I think influences our action back home. And yeah, I live the space here inspired to bring some of that knowledge along with me.
I'm not sure how many folks are here from delegations and how many are just our friends who were lovely enough to come out for us on 2 p.m. on the Friday. But I wanted to say, I know that currently there is a fight in L5 occurring in the cow. We're all kind of trying to pay attention. We're all like very captivated by it. If what we've kind of said today resonates with you, even if it's ever so marginal, I ask that you go talk to your governments about fighting for harm reduction, inclusion language in these resolutions. You know, I was here when Canada did its stigma resolution, and I watched as certain countries are doing what they're doing today and using the Friday to basically push stuff through because they don't want to break the consensus. And they're going to keep doing that because they know it works. It is something worth fighting for. I think because we'll never be able to move the dial further in the space if we can't get people to accept what the WHO, UNAIDS, and various other UN agencies have all agreed is important language for the last 10 years. So that's my one thing that I would say to you. Thanks.
I'm so grateful for the invitation and for the Youth Rights team. It's very important for me to be here. Yeah, I was thinking these days it's very complicated. I have many emotions, but it's complicated. When from here make decisions that impact our communities. The deaths of family, for overdose, it's very important. Impacted in the communities and the families. So the process is very hard. So I think that that's important. Just remember me that all the time. But that's all. Thank you for the invitation. You're right. Yeah.
And I'll be very quick. I think I leave here a little bit angrier than I came, so not so positive. There's obviously also all the positive elements that have been mentioned, but particularly this CND and growing more so every year, we're being talked about. Youth are being talked about. And then when UN agencies and governments say that they're doing youth engagement, they're not talking about young people who use drugs or young people who've engaged in the criminal justice system. They're talking about young people who have never used drugs. They're talking about prevention. Prevention will always miss some young people. And despite the global efforts to prevent us from doing drugs, many of us still do them. We matter as well. Our health and human rights matter as well. And that should also be a priority to all of you. So I think I'm feeling quite angry at the mentions of yes, quiet, we are doing youth engagement, let me tell you all these things we're doing, and actually they're only talking about prevention. There's no discussion about young people who use drugs at all and about our diversities. So yeah, I leave a bit angry, and I ask you to continue to raise our voices and to shoot down when people are telling you they're doing youth engagement. Ask them what that looks like and what are they talking about, and are young people who use drugs in the room? And if they're not, it's not youth engagement, it's young people who don't use drugs engagement. Yeah, thanks.
Thank you all very much. I think those are extremely powerful notes to leave this on and to take home with us from Vienna. Thank you very much to all of you once again. Thank you to this wonderful panel, and thank you to all of you for attending on a Friday afternoon. We can't emphasize that enough. It was a pleasure to share this space with you, and we look forward to further opportunities. So thank you very much once again.
Thank you.